Um, I you mean being a nurse or a nurse practitioner?
Nurse
Is where
practitioner.
so when I was practicing as a nurse, I was a nurse I've been a nurse since 2006. After 10 years, I realized I want to expand what I'm able to do to help patients out. So I went to go get my master's so I can do my role now where I can have direct patient influence instead of waiting for, doctors to give me orders.
Yeah. Was this the first career path you wanted to pursue?
No, actually, I wanted to be an accountant when I was coming out of school.
When did you commit to this career path?
Pretty soon after I graduated um, high school, I changed my major to nursing, like before I even started college.
Did
My
you?
my first.
Oh, nice. Yeah. Did you have any trouble getting to where you are now?
No,
Oh, really?
not.
Um, do you truly like what you do?
I do truly like what I do. There's just I think with any job, honestly, like you can like the things that you do as your actual job, but there's other factors, of course, that you have to consider that influence it. Like there's people above you that dictate. Unless you own your own business,
Yeah.
you're always gonna you're always gonna have to deal with relations outside of what you do primarily. If that makes sense.
Yeah. Do
Yeah,
you do you feel everything you have done to get to this point was worth it?
I think so. For myself and my family.
What do you find rewarding about this job?
Being able to help make it make a difference in people, especially when you can see immediate results after you do something for them and just help them get better.
How do you handle interactions with a patient's family who is unhappy with the nursing services you or your facility provided?
I think you just have to give them time to express their frustration, and then hopefully you can get them to where after they let it out, that they're more reasonable with you, and you can discuss what happened and what you can do to prevent it from happening in the future. Usually it's a miscommunication.
What medical fields have you spent time working in before, and which one did you enjoy the most?
I spent all my nursing career on a medical surgical floor. And then I've worked with kids in the past, but I like dealing with adults better. I don't like personally want to deal with sick kids because it's sad to me.
Yeah.
Yeah.
What part of your nursing program has most effectively prepared you for your career?
I think the years I spent as a nurse prepared me. Not necessarily like one area, but my experience because I did nursing for so long. Because I think some people like graduate nursing and go to be a nurse practitioner right away. But I think it's good to like kind of spend some time in the actual as an actual registered nurse because you get exposed to a lot more things than what you learn in school. Like when you go to nurse practitioner school, you'll learn a lot more practical things
Yeah.
on the job as a nurse.
Can you describe a time when you had a very sick patient and explain how you met their needs while caring for other patients?
As a nurse practitioner,
Yes.
it's kind of nice as a nurse practitioner because everyone's scheduled. And so if one patient's taking a little bit more, needing a little bit more time, my time, and it goes and makes me late for another visit, we usually have a good staff that will explain, that we will get to you as soon as we can. But right now, you know, we have to take care of an emergency. So that's usually how we do it.
Just a couple more, doctor.
Uh huh.
Where did you get your credentials?
I went to school at UNLV for my RN, and then I went to Walden University for my nurse practitioner degree.
What do you do if a patient refuses care at the risk of his or her own safety?
I always tell patients like when they don't want to do what I recommend or what's recommended for them because it's best, that I just have to make sure that they're aware of, the risks, and then I write it down, and that we've come to the understanding, because you really can't force anybody to do anything. But
Yeah,
the important thing is that you want to make sure that when they do decide for themselves what they want to do, that they understand what the risks are, not just because they want to do it.
yeah. Okay, last one. What
hmm
would you do if a physician questions the accuracy of your work?
I would discuss it with them. Like I welcome discussion, um, because it's a learning opportunity
Yeah. All right.
for
So
for
that.
both of us.
All right. Thank you. That was the last of the question. I know you're a busy woman, so I'll let you go. Thank you though.
Oh, okay, yeah. If you still